Hi, Sharik. Thank you so much for having here today to answer some of our questions.
You bet. Looking forward to it. Thank you, Christie.
So I was introduced to your product recently, the Rezzimax Pro Tuner. And specifically, a lot of people online are using it for mostly a lot of children with brain injuries, because as you know, there can be a lot of symptoms that go with their brain injuries, from swallowing issues to headaches, a lot that has to do with the vagus nerve and nervous system just being out of sync, basically, which can lead to a lot of emotional problems. So they're finding some really good results with your product. So I just wanted to basically, I have a young daughter with a brain injury, so I'll be using it for that. So I just wanted to ask you a few basic questions about how you get started with your product.
Sounds great. Thank you.
So when I first got it, I turned it on and I noticed that there's a on button, and you can increase the pressure and you can decrease it. And I also noticed that there were these color modes, and I read a little bit about it in your book, but I was just wondering if you could explain basically, if I was starting therapy for my daughter for the day in a home setting, how do I know what setting to choose and for the appropriate time?
Well, that's a great question, Christie. There are, we put a lot of variety in here because every child is going to be different and every adult's going to be different. So we do kind of need each parent to find the recipe that works the very best for their child. But let me tell you about the basics, and maybe that can help a person to decide what might work the best. There are 10 levels in these. This is kind of an arrow, this top one. It goes up higher and higher, and the third one down goes lower and lower. Those are the manual settings. And then there's 4 different algorithms. Each one, the second button down is the algorithm button, each one a different color. When it's on an algorithm, the ups and the downs don't work because the algorithm takes control of the device, if you will. And the algorithms are just waves. They're like waves of the ocean. They're different wave patterns that are going to provide a different symphony for the brain. So if you think of it as just simply music, that's what the brain registers those vibrational patterns in. And so if we, for example, use the blue pattern, it's just going to be a long, slow wave as far as what you feel. What the brain will register is about 3,000 calibrated energy points that are being fed into it in repeated patterns. So that blue one is a very good calmer. It's just a very good calming entity. So if you have a child that's fired up all the time, maybe has some ADD, ADHD issues, perhaps has autism spectrum issues, that blue one's a really good one just to bring them into a calm state of mind so that their brain functions better. The green one, the second one, is the exact same as the blue one, but it's going to happen 3 times faster. So it's more like, the first one's playing a long, slow piano piece. And the second one, the green one, is just going to speed that thing up to concert pace. But it's the exact same energy points. So sometimes if you've got a child that responds really well to the green, but you want to kind of grab their attention really strong for the next hour or two, put it on green. That will speed up the process of their brain focusing better. And the red one, which is the third one, this red one is absolutely completely reversed from the first 2. So you might think of this as more of a ride on a roller coaster rather than a day at the beach. The first 2 are very much like the waves of the ocean. The third one is it's a flipped or a reversed wave, which actually has the effect of grabbing the central nervous system's attention and focusing it on whatever you need to do. So I call it my wake up mode, that third one, that red one, because it will grab the nervous system's attention. Usually for most children with brain injuries, I like to use the red one followed up by green or blue. because I want to grab their attention, then I want to put it back into balance. And the blue and the green are great to put things into balance. The white mode is just it's what I call white noise or meditation. It's just kind of a meandering, it goes all over the place, but doesn't come back to the same spot. So it keeps your brain's attention without being overbearing on it. It's just kind of running in the background to keep you focused on whatever task you're doing. So from there, just from that basic understanding, you can apply it depending on what your child's needs are. If your child has a real difficult time with energy management, we might use the red mode followed by the green mode to put it into a good, strong humming balance, if you will. From there, it just depends on what the needs of your child, what needs you have. For some children that are prone to seizures, for example, we might put it on the long, slow blue wave and probably never go into the red mode, because I don't really need to, their nervous system's on high alert all the time anyway, and we just need to bring them into a much more calm state. So I might not ever use the red mode on somebody with seizures.
Now, what about, because I found the red mode I basically use for one thing, and I watched it on one of your videos and I found it very effective, but it's using the point with the red mode right on the belly button to activate the gut, because with brain injury, a lot of medications and just a lack of movement causes a lot of gut constipation issues. So is it still okay to use that red activation mode if seizures are?
Oh, yeah, I would especially use it, on the lower half of the body.
Oh, okay.
But I wouldn't use it, maybe if someone's prone to seizures, I wouldn't use it up around the head or neck. But I might use it on the stomach. But remember, we're always using the red followed by the green on the stomach, because we'll want to wake it up a little bit, but then we'll want to put it back into balance. And the green is going to speed up those processes. How have you seen that working for your little one?
I'm glad I had this conversation with you, because I wasn't following with the green, but I just know the red mode is very effective for the gut issues when they get stuck. So I really like that. Now, if you're trying to kind of calm your child down, because I know Denise, she can get stressed out in certain situations. And I've heard you talk about some, well, maybe you could try the Rezzimax during a stressful situation. So is there, if I'm just trying to get my kid to calm down and go to sleep, would it basically be the last two modes then?
So if you're, that's a great point. If a child is already super fired up, or an adult, sometimes you need to understand their brain dominance. So if, for example, if Denise tends to use her right hand mostly for grasping and grabbing, I would probably put it on the left side of her, because we're typically going into the weaker side of the brain, the side that's not used as much. So she uses her right hand a lot and left hand not so much. I would use the left hand or left leg as the input into the brain to say, whoa, let's calm back down. We find that in adults and in children, their dominant brain, their stronger hemisphere of the brain, tends to drive their frustration cycles. So we'll go into the weaker side of the brain, the side that's not used nearly as much as the calm down mechanism. That same process is what we do for individuals that are prone to a lot of seizures. We'll use that weaker side of their nervous system as the way to bolster up and bring them down out of a high nervousness or high tension state. And that oftentimes will just simply dissipate a seizure before it ever really comes on strong.
So I'm assuming this could be very useful for children with seizures to help manage them long term.
Definitely. And in an individual that is prone to seizures, we'll use a couple of things. Now, we'll use that weak side of the brain. We'll also use the wings on the device scraping on that side of the body that is also the weaker side, to grab the brain's attention and to help bring that into a more balanced state. So we'll scrape them at the fingers, at the feet, at the legs, the arms. Everything on that side of the body will work quite a bit to bring that whole stress level down in the child.
Yeah, I'm very glad we addressed that, because I know that could be a concern some if I should use it for children with seizures. But from what I've been hearing from other parents is they've had very good luck with it and managing, and they've had a lot of good results. So that's very good to hear. Another main thing I see a lot of parents and myself using it for is just the mouthpiece. And I know children with brain injuries tend to clamp up. They don't like their mouth messed with, but it's very important to desensitize them. So I was wondering if you could kind of go over how I would start using this on the mouth, especially to stimulate probably talking and swallowing. And if my child doesn't want it in the mouth, is it okay to go around, and how maybe a basic protocol of how I would do that?
Sure. There's a couple of concepts that would be really helpful. I'm trying to see where I have one of those little soft tip attachments like you've got on yours right now. But that little soft tip attachment is the one that I like to use on the skin. I don't like to use this tip directly on the skin because it's just a little sharper. But I don't have one sitting right here to demonstrate. So just realize, use that tip for trigger point attachments, but also use it for anywhere around the lips and mouth there. So a couple of things that would be really helpful to understand with that area. It is very, very critical that you work on the hand and the mouth. So many things, so many brain functions involve hand to mouth, hand to face. I mean, that's critical for feeding and for the development of our basic human abilities, is that we be able to get that hand to the mouth. So again, with the scraping processes and waking up the neurologic connections between the brain and that part of the body are very, very essential. So if I want to get a child to start using their mouth more, I'll start at the hand. Kind of seems a little backwards sometimes, but that's the way that we have found waking up that hand and arm connections helps them to be able to utilize their mouth and those processes better. Now, for most or for many individuals, they've got a lot of difficulty with swallowing and with producing excessive saliva. They're not utilizing that saliva in the correct way. And so as you stimulate, sometimes you'll see an increase in saliva production. You know, that's just telling you that the brain feels like it's heading in the right direction to be able to use more of the structures around the face and the mouth, right? But sometimes that worries a parent, saying, well, I was already dealing with a lot of saliva, now I'm dealing with more. Just be patient with that. And as you work on some of these structures around the jaw and the neck, a lot of that will start resolving in time. So some of the basic things that a lot of our doctors are using the device for is using it from the ear, the tip of the ear, or the hole in the ear, all the way down to the corner of the mouth, and they'll do that repeatedly. That is to help with the rooting reflex, a primitive reflex that's often present. It often is combined very much with the grasping reflex that we see in a little infant when they'll, you put your finger in their hand and they grasp it. Oftentimes that reflex doesn't integrate, doesn't work quite right until we get the mouth and that whole area working better. So we'll work on the rooting reflex by working down around that mouth, but from clear up at the ear. So following the trigeminal nerve, if you're an anatomy buff. So we'll work on the rooting reflex and we'll work on the palmar grasp reflex. There's several other very important reflexes here. So when you work around a child's lips, there's a muscle here that brings the lips together or points them out. It's important for those muscles, the buccinator and all these muscles, orbicularis oris, all these muscles around your lips need to work together in tandem to get that preparation for swallowing. Now, a lot of children just will stick this thing automatically in their mouth. And, you know, we made the tongue specifically so that that's a real easy thing to place inside the mouth. But if a child will allow you to, I'll even have the parents try and grab their tongue with the device. Some children will and some won't. It's not going to hurt them one bit. You can even cover the device with a cloth, put a flavor on it, you know, do something so that the child gets that sensory input from that area. And you're right, many children are super defensive about that area. But the benefits we see are tremendous. As you start working on that area, oftentimes you can see an improvement in gaining words. I spoke to a mom just the other day that said, you know, after she started working on this area for her 1-year-old child, within 2 weeks, the child had 30 words that they were using. And so it can be a real help to get a child over those roadblocks that sometimes they hit up against. Another one of the things that I'll do oftentimes is use taste. Another one of those sensations, and pair it with the vibration. So I'll take a, you know, like this is just a stick of peppermint or stick of cinnamon, sorry. And I'll stick it in the end of that little tubule and place that on the tongue or use that to stimulate the area. Sometimes I'll use a little piece of licorice or something that'll stimulate that area and also get the brain to start connecting with the taste and the sensation of the vibration. So those are some of the ways that that we'll use that. You know, one other one that might be a real help for you, Christie, is to get a small like sports mouth guard, just one of those little teeth guards. And you can place that inside a child's mouth and vibrate right on that to send that resonance through every one of their teeth. That's a real powerful technique, remembering that the teeth have a strong connection straight to the brain. Every one of them has real strong nerve connections, but they make a great delivery source for the vibration. But we'll just use a little plate for the child to place inside the mouth or over the teeth and vibrate right on that. So there's quite a few ways you can use it there, but I think your point is most important, Christie. That is, a lot of children are very defensive about that area, which tells you it really needs a lot of input. It's such an important area for the whole digestive system to work better and for speech to develop and the brain to function better. We've got to get that mouth in that area so that it's not overly sensitive, but that the brain has an awareness of all of the nerves that go to that very sensitive area and how to make the muscles and how to make the jaw work. All of that is helped by sending more information up to the top of the brain.
That's so I'm assuming this would probably be useful too for maybe someone with a brain injury whose child is teething, and that child doesn't necessarily chew on a lot of teethers like a normal child.
It works for any teething child. Normal, you know, developmental delays. We see many children or many parents using this with their teething children just because it's, well, number one, it takes away a lot of the pain. but it provides them the stimulus that helps them go through the process quicker.
Great. I really appreciate you explaining all the mouthpiece. I would also just, if starting basically, another question though I did want to cover is if someone was basically looking to improve the speech and swallowing, is there just a basic recommended time you recommend? So this amount of time every day for a couple weeks?
You know, if they were just to spend 10 minutes working on that area, it would be sufficient. And they can do it along with feeding time. You can take a spoon and tape it onto the end of that thing, and you can work with textures and tastes and normal sensations along with the vibrational resonance. So it can be extremely powerful. But 10-15 minutes a day would really help the child be able to have better awareness of where everything is at around the face and the mouth and the tongue and the lips and the cheeks and all those important muscles there.
Okay, and I'm glad we covered the hand too, because I know a lot of brain injury children's, their fists tend to stay clenched up. And I know this is a good effective way to kind of get them to loosen up.
Mm-hmm.
Are there any other kind of key areas if you were doing this at home to focus on? I understand if they're in the stander, it's a great time to focus on the back. Is there a way to kind of wake up the nervous system, vagus nerve with the back, or do you kind of go to certain points?
So you've got a great question there. First of all, if I'm putting a child in a stander, or if I'm going to work on prone activities, extension activities, I will typically take the device, turn it on its highest setting, and I will use the wings from the tailbone all the way up the spine. I will slowly scrape up the spine with some good pressure into those muscles on the sides of the spine. That's what the wings are for. They hit the sides of the spine, or the muscles in the sides, without actually hitting the spine. But I'll rub that from tailbone to base of the skull probably a good dozen times to just wake up those spinal pathways that are a part of the extension response. So I'm helping the brain wire the connections so that once you get them into standing, it's a lot easier for them to remember how to find those muscles, those postural muscles that'll help keep them up. In standing, I'll oftentimes put the device back again on the weaker side of the body. I'll strap it to their leg or their thigh, or I'll put it in the hip pocket or put it behind, but I'll usually put it on the weaker side of them so that the brain's getting more input from that weaker area while they're doing the standing activities. I find that is extremely helpful for prone progression and also for standing.
And now, another question I had is, I know besides the fist, a lot of brain injury children's feet is a big issue because they tend to kind of tilt them sideways. Or I know when Denise first got her brain injury, she didn't want anything on her feet. It's very sensitive. Could you kind of go over, are there some benefits on working on the feet, lower leg area, and how to kind of do that if your children is oversensitive?
Oh, you bet. The feet are probably one of the most important areas to send messages to the brain. If you think of it, they're the absolute longest nerve endings from the brain, and they send messages up through every single joint sensor, every muscle, every piece of the anatomy from the toes all the way up helps send messages to the brain. So it makes it a hotbed, if you will, for messaging to get the brain to start balancing. So yes, they become super sensitive oftentimes when a person has had a brain injury, but they're also really important to work on. So if a child or an adult is too sensitive to use vibration on them, I'll just cover it. I'll cover the foot with a towel, or use the vibration through a pillow, or we'll keep their shoes on and we'll work on it from there. So you don't have to torture a person. But very quickly, as you start working with them, they will respond to it. If you think about it, every time you use the device on them, 24 to 48 hours later is the response that you will see from the input that you gave. So today it might feel like it's very sensitive and ticklish. Just work through that a little bit. And 2 days from now, look at the progress that they've made in being able to push with their foot or wiggle their toes. I put a video on our YouTube channel recently of a woman that was completely paralyzed from a spinal cord injury and had no ability to sense and feel in her right lower extremity. We started scraping and working with it. She said it was excruciatingly painful at first for her to sense and feel these pressures. But within seconds, her brain made the connection and she started being able to move her toes and then being able to move her foot. And so even though it feels like a torture for a few seconds, with the device turned on high, it will help the brain make connections that it was struggling to be able to make before. So we'll scrape and we'll do that from the tips of the toes, inside of the toes, around the toes, the top of them. I tell people, try and catch every square inch of skin from the tips of your toes all the way up to your thigh, because that's going to, or all the way up to your hip anyway, because that's going to help the brain make connections with that lower extremity, with both lower extremities. There are techniques where we'll put the tongs on and try and connect both feet and both sides to the device, because the brain needs that bilateral input. But then there are a lot of times that we'll just use the scraping and work especially on the side that has less ability of the brain to control it. So if you're going to work on the whole body, spend about 2/3 of your time or 3/4 of your time on the side that's weaker and a lot less time on the side that's already got a much stronger input to the brain.
Okay, so I could see that you could use this to kind of connect both feet, or I assume if you had 2 units, you could kind of use it on one on an arm or a leg. So you could kind of, if you had 2 units, I'm assuming there'd be more benefits.
So it is. I like to use just 1 unit for the first month or 2, so that we're really teaching a child the patterns. But then you're right, it speeds it up to have, two different units or 2 different algorithms going and for different purposes. You might put the right side on calm down mode on blue, and you might put the left side on green mode to speed it up. And you can give the brain a whole lot more good information that way. But more important than anything is that you spend a lot of time with those scraping and reconnecting processes, because the brain really needs to be aware of where its toes and fingers are in space, a concept we call proprioception. The brain needs to be more aware of those parts so that it can start to control them. If it can't sense them or feel them, it can't control them. So if you think of that concept, we're just trying to wake up those areas. And I think every parent should do these on themselves so that they know what it feels like, so that they know what their child will be sensing and feeling as well.
Yeah, I think that's a great introduction. I really appreciate you showing us all those. And I also want to encourage people to check out your YouTube channel and your Facebook channel, because you have a ton of videos of ways to use it, and I could go over them all day, probably, from headaches to sore feet to the gut. So especially if you go there and check out Sharik's YouTube videos, you have a lot of uses for this.
Well, thank you. But Christie, I want to tell you one of the most important things that I have learned. I've been a PT for a lot of years, and I've worked in the pediatric arena for a lot of years. I learned so much from parents like you. I call you my mama bears out there. because you are becoming an expert in child neurology after a brain injury or with a cerebral palsy or autism. You mothers are becoming self-educated and figuring out ways to help your children. So I'm learning a lot by watching what a lot of the other mama bears out there are doing. And so get on social media and watch and get on groups that have other children that are similar, and keep sharing that knowledge back and forth with others, because we all benefit by sharing.
And I think those who spend the amount of hours that a mom does with a brain injury child, you spend your all night, all day. Those are really the who know best, because we learn from our child. We're with them so much. So yeah, I think it's very important to get involved and bounce ideas off each other.
Well, thank you for doing that, and for being so diligent, and for helping others to understand things that you've learned.
Yeah, I really appreciate your time today too. I learned a lot about how to use it more, so I'm excited to try some of these new things.
Thank you. And if you have additional questions in the future, let's do this again.
Okay, thank you, Sharik. I really appreciate it.
You bet. Have a good day.